We recognize that with current strains on our hospital systems due to COVID, the compact is assumed to solve these problems. But I and my fellow nurses are here to tell you today that it will not. What it will do is distract from the roots of our current workforce issues. First and foremost, it's important to recognize that there is no shortage of RNs in Minnesota. There are 120,420 registered nurses in Minnesota, and the number of RN licenses has increased over 13,000 in the past 5 years.
Nurses are leaving the bedside, and as we walk away, it seems the question is not why are they walking away and what can we do to make them stay, but instead seeking to replace us with temporary out-of-state workers. I think we would all agree that the inpatient healthcare system in Minnesota is sick. We all know that we must do something. However, prescribing this treatment is going to make Minnesota's hospitals' chronic illness worse. This is not a simple accounting problem. This is not an acute 6-week staffing crisis illness in Minnesota hospitals. We must treat the underlying disease, or it could be disastrous for healthcare in Minnesota.
I'm here to tell you why the Nurse Licensure Compact is not only bad for my profession, but it's bad for all Minnesotans. I went to nursing school in Arizona, where I practiced LPN and got my RN. And then I spent the most of my 12-year career as an RN in Florida. Both of these states are compact states, so I have immediate experience with the NLC. After 9 years as a nurse in Florida, I moved back here to my home state, where I am a critical care nurse and ECMO specialist at Abbott Northwestern. I went through the process of gaining a temporary license as a pathway to full Minnesota licensure in order to ensure that my practice standards were up to the Minnesota standard. This took me about a week. This was not a difficult process. It wasn't a timely process, but it was a process that I think is necessary because to me it said, we care who we label the most trusted profession in the country.